The NHS was recently working out at Lancaster University when senior managers gathered for the latest event to be hosted by the newly formed Health Leadership Centre, which is part of the world-class management school.
Well, today we've got the hot topics, and that is a forum where we've brought in sort of key decision makers in the NHS to come along and explain and discuss key issues that are going to influence the NHS next 12 months and beyond.
If we can get improved clinical pathway and care management through our system,
We think it's an excellent forum for leaders to come here, understand what's occurring and learn, but more importantly, have an impact on their organisation when they go back to it.
it will effectively release some capacity. One of the great challenges for the NHS is how does it try to understand that as a huge organisation it's got to become more innovative in the way that it does its business. It's not good enough anymore to do what we've always done, because if we carry on doing what we've always done, we'll always get what we've always got, and we know we've got to step up our game to provide better services for the public. So we've got to embrace innovation, which means perhaps taking a few more risks. It means understanding what works and what doesn't and evaluating that. And so understanding again the academic base for leadership and management is very, very important.
The first point I'd like to put to you is that the NHS is coming towards the end of a paternalistic approach that it's had ever since it was created. The NHS is going through a tremendous period of change once again at the moment. We have the combined effects of the economic downturn making life difficult for the NHS in terms of potential future investment, but also starting to feed through in pressures and challenges for the population that we provide healthcare to. We know that people will suffer more from depression, we know substance misuse will go up, we know that people make a greater demand on the NHS. So I think we've got to be innovative to find our way through, and those combined challenges of innovating in an economic downturn, it's something that we've really got to give some thought to.
Well, leadership's critical to driving NHS innovation, and many of the innovations that we've had in the NHS have been the result of individual leaders or indeed teams that have led particular developments. And leaders can come from within organisations. They're often leading clinicians, they're often people who are working at the sharp end who recognise how to improve a system or process, and then are able to champion those ideas. But there needs to be a leadership culture and philosophy across the whole organisation that supports leaders in those areas.
When I think about the challenges facing us in the next 3 or 4 years, the obvious place to start is the economy. The recession is going to put a lot of pressure onto public services expenditure. And we've got to be big enough and strong enough to deliver improved results for the same level of resource we get now. We can't believe that there's going to be more and more money coming in on top of that. So we've got to examine everything we spend our money on. We've got to think about how we can reduce waste. We've got to think about how we can use innovation to drive improvement without costing the taxpayer more and more money. So that's quite the biggest challenge we face today.
In addition to hosting events and providing leadership development programmes, the Health Leadership Centre is strengthening its research activities in partnership with the 14 affiliated NHS Trust members and other health sector organisations throughout the UK.
I think there's a real opportunity at the moment for some research into the different healthcare systems that now exist in the 4 countries that make up the United Kingdom. We have a very market-based system now in England, whereas in Wales, Scotland and Northern Ireland they've reverted perhaps to a more traditional model of health boards. And I think looking at the compare and contrast the differences, but the differences in terms of what does it mean for patients is an area that I'd like to see work being done.
We could be helped enormously by a centre like this doing research into leadership, by understanding what works. What are those interventions that effectively have made the difference? Improve quality, reduce cost. And as soon as we know that, how can we use a facility like this and an organisation like this to help us spread that to every practice?
One of the great advantages of working with the Health Leadership Centre is that we're able to tap into a very wide range of resources from people from different specialisms and different backgrounds who can come and work with us in the NHS and help improve our leadership approach and leadership style. And just as one example, economics, health economics is not a resource that we're able to have in our own PCTs, but by working with the university we can tap into some international experts who are able to bring this down to local level and down to local healthcare delivery.
Health leadership is an obvious place for this university to be at the moment. You're sitting in part of a truly world-class management school. On top of that, we have an emerging position, we believe, in health and medicine.
The Health Leadership Centre will soon complete its first successful year of operation. So for the Centre's Director, Professor Ian Denston, what are the priorities for the future?
I think we have further collaboration through our courses and research. Already we have established courses that are targeted at leadership development, and we have programs that look at issues, research issues which are affecting the NHS today and tomorrow. This is sort of a key area that the Health Centre would actually like to further develop, and it will do.
For more information about leadership development programs and research opportunities, contact the Health Leadership Centre at this address.